Three teams of 26 doctors, 40 plus paramedical staff, 7 days, 9 camp locations, thousands of patients, and one goal: healthy society, healthy India. India is a land of pilgrimage. People visit holy places for spiritual wellness, but for existence, physical well-being is more significant. There are many who are unable to make a pilgrimage for physical wellness. The Rotary Club of GANDEVI understands this and has been ensuring that the last human in the social pyramid gets to undertake the journey since past 20 years. The club initiated the Medical Pilgrimage Project in 2009 and has organized a mega medical camp for the third time in 2019. The core idea behind Medical Pilgrimage Project is, if the pilgrim cannot make the journey, take the pilgrimage right at his or her doorstep. Any pilgrimage is incomplete without the blessings of saints. Rotary Club of GANDEVI has managed to bring 26 saints, a team of doctors with the help of the philanthropic couple Ramesh Bhai and Dr. Jaya Shah, trustees of APNO USA, the Association of Indian Physicians of Northern Ohio. The association has been doing this work since past many years. The doctors, aged 25 to 70 years, travel to India with the sole purpose of improving the health of the common mass. India has emerged as a preferred destination for medical tourism, and yet there are millions of Indians still struggling to get basic healthcare. These patients come from a stratum where healthcare is a luxury rather than a necessity. To ensure that maximum people from the socio-economic weaker section benefited from the pilgrimage, the Rotary Club of GANDEVI, in association with multiple like-minded organizations, identified 9 different campsites. These were Gadat, Kharel, Alipur, Viara, Shivarimal, Amalsar, Abrama, Bardoli, and GANDEVI. As the day dawns, a steady stream of patients is seen outside the campsites even before the arrival of the doctors, waiting their turn to register and get examined. The visiting doctors are treated with a welcome in no lesser degree than the reverence shown at the arrival of holy saints. The patients were screened in 4 critical departments, namely gynecology, pediatrics, general health, and ophthalmology. The medical pilgrimage has proved to be as much a satisfying journey for the doctors, organizers, and all those who were associated, a privilege of giving a part back to the society. Breaking the barriers of language with the help of volunteers, the doctors patiently listened to the patients, understanding their troubles, especially in the tribal area where more than 2,000 people awaited their turn. One of the objectives during the camps was to instill good hygiene in children, and so along with the main camp, general checkup, especially dental health checkup, was carried out in tribal residential schools, where more than 650 students were screened. This will continue further in February with 4 other schools. The teaching staff and students were educated in administering proper CPR, a first aid technique which can help in saving lives. Patients were given the necessary medicines right at the camp, completing the cycle of proper preliminary screening, starting with checkup followed by diagnosis and treatment. The aim of this pilgrimage was to purify the body and offer physical well-being to the pilgrims. In the cases where further treatment were to be given, the patients were sent to partnering hospitals where they were welcomed with compassion and gratitude. Operations like cardiac, spine, and ophthalmic were carried out along with detailed diagnosis using CT scan and MRI.
તમારે આ પ્રોબ્લેમ છે ને ઓપરેશન કરાવવું પડશે ને બધું સપોર્ટ બહુ ફાઇન છે ડૉક્ટરોનો નર્સો ને આવી ફર્સ્ટ ક્લાસ હોસ્પિટલ તમને ખ્યાલ સપનામાં ખ્યાલ નહીં હતો કે આવી હોસ્પિટલ નવસારીમાં છે પણ મારી છોકરી તો બહુ આભાર માને છે ને હું પણ બહુ આભાર માનું છું રોટરી ક્લબનો તમારા જેવા માણસોને સપોર્ટ કરતા રહી.
બારડોલી 15 તારીખે કેમ્પ યોજાયેલો હતો એમાં અમે નામ નોંધાવેલું એના મારફત અમે અહીંયા આવ્યા છે અને અમને ટ્રીટમેન્ટ મળી છે. આ રીતે અમારો ઈલાજ થયો છે. એના માટે ગંદેવી રોટરી ક્લબનો ખૂબ ખૂબ આભાર.
This humongous project was possible due to the outstanding support of the following institutes. The $100,000 global grant from the Rotary Foundation, which would not have been possible without the support of Rotarian Amrit Patel of Playful India Foundation, APNO, Rotary Club of Baskerville, District 5240 and 3060 and Rotarian Yogesh Desai from Canada as well as RI District 1260 UK strengthened the determination of the Rotary Club of Gandevi to take on this pious medical pilgrimage and bring a change in the health of thousands of pilgrims who visited the camps. Statistics show that a total of 6,300 patients were screened at the camps, 1,217 eyeglasses distributed, 151 ophthalmic, 145 cardiac and 560 general patients were referred for further treatment. From these, 12 angioplasty, 3 valve replacements, 4 bypass and 4 heart surgeries of tribal children along with 67 general surgeries, 19 angiograms and 3 orthopedic surgeries including 1 critical spine surgery of a tribal boy have been performed successfully. Everything is totally free to the patients. This medical pilgrimage brought physical well-being in thousands of lives. The Rotary Club of Gandevi expresses gratitude to Team APNO, the Rotary Foundation and all associated institutes for their selfless service. This medical pilgrimage will continue its journey in the coming years and will contribute in making a happy, healthy society and India as a nation.